Other than skin cancer, breast cancer is the most common cancer in American women. Every woman is at risk for breast cancer. If a woman lives to be 85, there's a 1 out of 9 chance that she will develop the condition sometime during her life. A lot of the cancer cases are found in women over the age of 50. Breast cancer knows no color. Breast cancer knows no age. Breast cancer knows no economic status. Breast cancer knows no social status. Breast cancer knows no gender. Breast cancer does not discriminate. Any woman or man of any race can get cancer. But what many might not know is that minorities, especially African American women, have a higher breast cancer mortality rate than white women. The chances of dying from breast cancer is 16% higher among African American women than white women. Although occurrence rates from breast cancer are lower for minority women than white women, according to Sister Network, minority women contract breast cancer at 10% lower rate than white women. You would seem to think that minority women have an advantage over white women in terms of reduced breast cancer risk. Unfortunately, survival rate for this disease reveals a different story. The National Cancer Institute demonstrating that 5-year survival rate for breast cancer is 81% for white women compared to only 64% for African American women. Early detection saves lives when it comes to many kinds of cancer. Breast cancer often responds to prompt treatment. Mammograms are important to quickly identify lumps that may lead to cancer threats. Breast cancer research stressed the importance of mammograms in the early spotting of possible breast cancer. Although mammograms are not perfect, mammograms are the best method to find breast cancer that cannot be felt. Mammograms can lead to critical medical intervention that may add many years to a woman's life. But unfortunately, in some African American women cases, mammograms may not help because of a fast growing cancer that has already spread to other parts of their body due to being diagnosed too late. Like everything else, mammogram has benefits and risks. The benefits of a mammogram are the imaging of the breast improves the doctor's ability to detect small tumors, increase the detection of small abnormal tissue growth confined to the milk ducts. No radiation remains in a patient's body after an X-ray examination. And X-rays usually have no side effects in the diagnostic range. Unfortunately, the risk factors of a mammogram. Women who have yearly mammograms between the ages of 40 and 49 has about a 30% chance of having a false positive mammogram at some point. And there's always a slight chance of cancer from excess exposure to radiation. But the benefits of an accurate diagnosis far outweighs the risk. So why aren't African American women not getting mammograms? Good question. African American women don't realize the seriousness of what breast cancer is for them and that early detection saves lives. These are the reasons minority women don't get mammograms. Not having access to health care and follow-up, distrust of the healthcare system itself, the belief that mammograms are not needed, that they can't get breast cancer, and the cost of the mammogram and no health insurance. Unlike other minority groups, African American women will put the welfare of their family and their kids before their own and forego the cost associated with their own health, but not realizing there are organizations like the American Cancer Society and the American Breast Cancer Foundation that sponsor free breast cancer and screening. Let us recap. Breast cancer is the second most common cause of cancer death among African American women, although fewer African American women get the disease compared to white women. Early detection saves life. Mammograms are the best method to find breast changes that cannot be felt. Unfortunately, as important as mammograms are, African American women still don't get mammograms because of lack of knowledge, fear of the unknown, no time, feel that anyone with breast cancer will eventually die, and the cost. You're probably wondering why I'm so passionate about this particular subject. Well, it's because of this woman, my mom. My mom was recently diagnosed with breast cancer. It was devastating news for me because my mom is my best friend. I couldn't imagine life without my mom in it. Fortunately, it was detected in the early stage because of her yearly mammogram. She was lucky. The cancer was stationed in one area of the breast and small in size. By detecting the cancer early gives my mom options of treatment and a higher survival rate. It's a great time to be an African American woman at a time in the history of this country when America is recognizing and embracing the beauty and intelligence of women and minority. Unfortunately, these women are at greater risk of dying from breast cancer. So with that in mind, encourage your sisters, mothers, daughters, aunts, grandmothers, and any other important woman in your life to get a mammogram regularly. Too many of our African American women die needlessly from breast cancer who might have lived with early diagnosis and treatment.